Hi, I'm Chris with the New Mexico Aging and Disability Resource Center, and I'm here today to talk to you about Part D prescription drug plan appeals. Today we'll discuss what you can do if your Part D plan will not cover a medication that you need. Number one, understand your right to appeal. If your Part D plan denies coverage of your medication, you may appeal the decision. A Part D appeal is a formal request for review of a coverage decision made by your Part D plan. The appeals process will be the same whether you get your drug coverage through a standalone Part D plan or as part of your Medicare Advantage plan. There's more than one level of appeal, and you have the right to continue appealing if you aren't successful at the first level. Be aware that at each level of appeal, there's a separate time frame for when you must file the appeal and when you will receive a decision. Number two, file an exception request if your Part D plan will not cover your drug at the pharmacy. If your pharmacist tells you that your plan will not pay for your prescription drug, the pharmacist should give you a notice titled Medicare Prescription Drug Coverage and Your Rights. First, call your plan to find out the reason it isn't covering your drug. There are various reasons why a plan might do this, and knowing the reason is very important to your appeal. Here are a few examples of reasons why a Part D plan may deny coverage. The drug isn't on the plan's list of covered drugs or formulary. You need to request approval from the plan before it will cover that drug. This is called prior authorization. Your plan requires that you try a different, usually less expensive drug first. This is called step therapy. Your drug has been prescribed for off-label use. This means that your doctor has prescribed the drug for a reason other than the uses approved by the FDA. Once you know why your drug wasn't covered at the pharmacy, speak to your prescribing provider about your options. For example, you may be able to try a comparable drug that your plan does cover. If switching to another drug isn't an option, you'll need to file an exception request with your plan. This is a formal request for your plan to cover your drug. Contact your plan to learn how to file one. Ask your doctor to provide a letter of support that directly addresses the denial reason. If your request is approved, your drug will be covered. If it's denied, your plan will send you a notice of denial of Medicare prescription drug coverage. This is your formal denial notice from the plan, and now you can begin a formal appeal. Part 3, start a Part D appeal. You have 60 days from the date listed on this notice to file an appeal. Directions on how to appeal are on your denial notice. Your provider may appeal on your behalf or help you with the appeal process, but they aren't required to do so. If a doctor is not appealing on your behalf, you should ask them to write a letter of support addressing the plan's reasons for not covering your drug. If your plan approves your appeal, your drug will be covered. If your appeal is denied, you can choose to move to the next level of appeal. There are 4 levels of appeal after this first step. At each level, if you are denied, follow the instructions on the denial notice to submit your next appeal. Follow all deadlines carefully. If your appeal is approved at any point, your Part D plan should cover your drug until the end of the calendar year. Be sure to ask your plan if they will continue to cover the drug after the year ends. If they will not, you can appeal again next year or consider switching Part D plans during Medicare's open enrollment period to a plan that does cover your drug. Point 4, check your Medicare notices for potential Medicare fraud, errors, or abuse. Your Medicare Advantage plan or Part D prescription drug plan typically sends you a statement after you received medical notices or items. This is called your explanation of benefits or EOB. It's important to read your EOB as soon as you receive it to make sure you actually received all the medication, services, or items listed. An EOB is not a bill. If you think there has been a billing error, call your healthcare provider or plan first to try to get it corrected. If the potential errors are not corrected by your provider or you still have additional questions, contact your Senior Medicare Patrol or SMP. The Senior Medicare Patrol program empowers and assists Medicare beneficiaries, their families, and caregivers to prevent, detect, and report healthcare fraud, errors, abuse. Your New Mexico SHIP and SMP are here to help with options, appeals, errors, and any other issues with your Medicare coverage. You can reach us at 1-800-432-2080. Check back next month for an update on what's new in Medicare for 2024. Thank you.